Question 1. The nurse receives report on 4 patients. Which patient requires immediate assessment based on risk for rapid deterioration? A. A post-op patient with 6 out of 10 abdominal pain who received opioids 30 minutes ago. B. A diabetic patient whose glucose is 240 milligrams per deciliter and awaiting insulin. C. A patient with restlessness, shortness of breath, and decreased SpO2 from 95% to 88%. D. A patient with mild nausea after oral antibiotics. Answer: C. A patient with restlessness, shortness of breath, and decreased SpO2 from 95% to 88%. Rationale: the decline in oxygen saturation with restlessness signals impending respiratory failure. This patient may decompensate quickly without prompt airway intervention. Question 2. During shift handoff, which assignment should the RN question when delegating to a UAP? A. Assisting a stable elderly patient with ambulation using a walker. B. Checking blood glucose on a stable diabetic patient. C. Feeding a stroke patient with dysphagia who requires chin-tuck swallowing. D. Transporting a discharged patient via wheelchair. Answer: C. Feeding a stroke patient with dysphagia who requires chin-tuck swallowing. Rationale: this patient has a high aspiration risk, requiring skilled assessment and supervision, not appropriate for UAP delegation. Question 3. A post-op patient's blood pressure drops from 126/78 to 88/54 millimeters of mercury, and the patient is pale and diaphoretic. What is the nurse's first action? A. Check the IV line for patency and increase fluid rate. B. Assess the surgical site and drainage. C. Reassess vital signs in 15 minutes. D. Notify the surgeon of hypotension. Answer: B. Assess the surgical site and drainage. Rationale: the nurse must first assess for internal or external bleeding as the cause of hypotension before initiating interventions or calling the provider. Question 4. A patient receiving IV potassium complains of severe burning at the IV site. The IV site appears red and swollen. What should the nurse do immediately? A. Stop the infusion and remove the IV catheter. B. Slow the infusion rate and apply a warm compress. C. Flush the IV line to relieve discomfort. D. Continue infusion and monitor for worsening symptoms. Answer: A. Stop the infusion and remove the IV catheter. Rationale: potassium is a vesicant. Infiltration can cause tissue necrosis. The nurse must discontinue infusion immediately and report the event. Question 5. The nurse receives 4 call lights at once. Which patient should the nurse attend to first? A. A patient reporting chest heaviness and diaphoresis. B. A patient requesting assistance to the bathroom. C. A patient needing pain medication. D. A patient who dropped their meal tray. Answer: A. A patient reporting chest heaviness and diaphoresis. Rationale: these are hallmark symptoms of myocardial infarction, which requires immediate assessment and ECG monitoring. Question 6. The nurse delegates vital sign measurement to a UAP. Which finding must the RN evaluate personally before deciding on next steps? A. Temperature 100.8 degrees Fahrenheit, 38.2 degrees Celsius. B. Blood pressure 118/72 millimeters of mercury. C. Heart rate 48 BPM in a post-op patient receiving beta blockers. D. Respiratory rate 20 per minute. Answer: C. Heart rate 48 BPM in a post-op patient receiving beta blockers. Rationale: the RN must assess for bradycardia and potential medication side effects. Clinical interpretation is beyond UAP's role. Question 7. A tracheostomy patient's oxygen saturation falls to 84%, and the UAP reports gurgling sounds. What is the most critical first action by the RN? A. Check for loose trach ties. B. Suction the tracheostomy tube immediately. C. Reposition the patient to a semi-Fowler's position. D. Notify the respiratory therapist. Answer. B. Suction the tracheostomy tube immediately. Rationale. Gurgling and hypoxia indicate secretion obstruction. Suctioning restores airway patency before other interventions. Question 8. Which nursing task may be safely delegated to a UAP caring for a patient newly diagnosed with heart failure? A. Reinforcing dietary sodium restrictions. B. Measuring and recording daily weights. C. Monitoring for edema progression. D. Evaluating fluid balance trends. Answer. B. Measuring and recording daily weights. Rationale. UAPs can collect objective data, like weights, but interpretation and patient teaching must be performed by an RN. Question 9. During a blood transfusion, the patient develops chills, tachycardia, and flank pain. What is the priority nursing action? A. Stop the transfusion and maintain IV access with saline. B. Notify the provider immediately. C. Reassess vital signs in 15 minutes. D. Send the blood bag to the lab for testing. Answer. A. Stop the transfusion and maintain IV access with saline. Rationale. Stopping the transfusion halts exposure to the causative antigen and prevents worsening of the transfusion reaction. Question 10. Which assignment is most appropriate for an experienced LPN under RN supervision? A. Initiating a care plan for a newly admitted patient. B. Titrating IV vasopressor medications. C. Monitoring a stable patient with chronic hypertension. D. Evaluating the effectiveness of discharge teaching. Answer. C. Monitoring a stable patient with chronic hypertension. Rationale. LPNs can provide care and collect data for stable, predictable patients. Assessment and evaluation are RN responsibilities. Question 11. A patient on a heparin infusion reports new bleeding gums. What is the nurse's immediate priority? A. Stop the infusion and assess for further bleeding. B. Notify the healthcare provider. C. Check the latest APTT level. D. Document the finding. Answer. A. Stop the infusion and assess for further bleeding. Rationale. Stopping the heparin prevents additional bleeding. Assessment precedes provider notification. Question 12. The UAP reports that a post-op patient's dressing is saturated with fresh blood. What should the RN do first? A. Apply pressure and reinforce the dressing. B. Ask the UAP to change the dressing. C. Call the surgeon immediately. D. Document the observation. Answer. A. Apply pressure and reinforce the dressing. Rationale. Reinforcing the dressing controls bleeding temporarily while maintaining sterility before further interventions. Question 13. A patient with COPD becomes agitated and their SpO2 decreases to 85%. What is the nurse's first action? A. Apply high-flow oxygen at 6 liters per minute. B. Encourage pursed lip breathing and upright position. C. Notify the healthcare provider immediately. D. Prepare for intubation. Answer. B. Encourage pursed lip breathing and upright position. Rationale. In COPD, controlled breathing improves ventilation without causing CO2 retention. Oxygen should be titrated cautiously. Question 14. The nurse is floated to the ICU. Which patient should be assigned to this nurse? A. A patient on mechanical ventilation with PEEP of 10 centimeters, H2O. B. A patient receiving IV vasopressors for septic shock. C. A stable post-op patient on room air after sedation. D. A patient with chest tubes requiring frequent suctioning. Answer. C. A stable post-op patient on room air after sedation. Rationale. Float nurses should be assigned stable patients within their competency and experience to maintain safety. Question 15. After a patient receives double the prescribed dose of morphine, what is the nurse's first action? A. Assess respiratory rate and level of consciousness. B. Notify the provider of the medication error. C. Administer naloxone per protocol. D. Document the event in the incident report. Answer. A. Assess respiratory rate and level of consciousness. Rationale. Assess first to determine the severity of overdose and guide emergency actions. Question 16. Which patient requires immediate nursing intervention? A. A patient with mild hyperglycemia. B. A patient reporting new-onset confusion and drooping face. C. A patient with 5 out of 10 abdominal pain. D. A patient with mild hypertension. Answer. B. A patient reporting new-onset confusion and drooping face. Rationale. Sudden neurological changes suggest an acute stroke, a time-critical emergency. Question 17. A UAP reports a post-op patient became dizzy while ambulating. What should the RN do first? A. Ask the UAP to return the patient to bed. B. Go assess the patient for orthostatic hypotension. C. Notify the provider of the dizziness. D. Instruct the UAP to take vital signs. Answer. B. Go assess the patient for orthostatic hypotension. Rationale. The RN must reassess delegated tasks when a patient's condition changes. Assessment cannot be delegated. Question 18. Which of the following tasks should the RN not delegate to a UAP? A. Feeding a patient on aspiration precautions to B. Measuring urine output on a stable patient to C. Assisting a patient with ambulation. D. Obtaining daily weights. Answer. A. Feeding a patient on aspiration precautions. Rationale. Feeding requires skilled supervision due to aspiration risk, not within UAP scope. Question 19. The nurse finds a patient lying on the floor, awake and alert. What is the priority action? A. Assess for injuries and vital signs. B. Help the patient back into bed. C. Document the fall and notify the provider. D. Ask the UAP to obtain assistance. Answer. A. Assess for injuries and vital signs. Rationale. Assessment ensures the patient's immediate safety before any movement or reporting. Question 20. A patient with suspected sepsis is febrile and hypotensive. What is the priority nursing intervention? A. Obtain blood cultures before administering antibiotics. B. Administer broad-spectrum antibiotics immediately. C. Start IV fluids at a rapid rate. D. Notify the provider of abnormal vital signs. Answer. A. Obtain blood cultures before administering antibiotics. Rationale. Cultures must be drawn prior to antibiotics to identify causative organisms and ensure effective treatment. Question 21. A 62-year-old post-op patient, 2 hours after abdominal surgery, becomes pale diaphoretic, HR 128 BPM, BP 78 over 46 millimeters of mercury, RR 24, O2 sat 96% on 2 liter. What should the nurse do first? A. Increase IV fluid rate and call the surgeon. B. Reassess vital signs in 15 minutes. C. Apply oxygen at 6 liter per minute via non-rebreather. D. Administer PRN opioid for pain. Answer. A. Increase IV fluid rate and call the surgeon. Rationale. Hypotension plus tachycardia plus pallor post-op suggest hemorrhagic shock. First intervene to support circulation, bolus or bolus IVF per protocol, and notify surgeon immediately. Delaying reassessment or oxygen alone won't correct hypovolemia. Question 22. A patient on telemetry reports sudden chest pressure. ECG shows new ST elevation in leads 2, 3, AVF. BP 110 over 70 millimeters of mercury. HR 100 BPM. What is the nurse's immediate action? A. Prepare and administer sublingual nitroglycerin. B. Activate the cath lab or notify cardiology immediately. C. Obtain troponin level stat. D. Give aspirin chewable 325 milligrams per protocol. Answer. D. Give aspirin chewable 325 milligrams per protocol. Rationale. In suspected acute MI, chewing aspirin is a time-critical first step to reduce thrombus progression while simultaneously activating the cath lab. Aspirin precedes cath lab activation in immediate bedside actions. Question 23. A patient with sepsis has temp 39.2 degrees Celsius, BP 86 over 52 millimeters of mercury after 500 milliliters bolus, lactate 4.5 mol per liter. Which action is highest priority? A. Obtain blood cultures and give broad-spectrum antibiotics now. B. Start norepinephrine via peripheral IV. C. Draw ABG and repeat lactate in 2 hours. D. Arrange transfer to ICU. Answer. A. Obtain blood cultures and give broad-spectrum antibiotics now. Rationale. Early antibiotics after cultures within the first hour are proven to reduce mortality. Fluids and vasopressors are also important, but obtaining cultures then administering antibiotics is the prioritized, time-sensitive action. Question 24. A patient receiving a blood transfusion develops fever 38.9 degrees Celsius, hypotension, and diffuse urticaria. What is the nurse's first action? A. Slow the transfusion and give acetaminophen. B. Stop the transfusion and keep the IV line open with normal saline. C. Administer IV diphenhydramine and continue transfusion. D. Document and notify provider after the transfusion finishes. Answer. B. Stop the transfusion and keep the IV line open with normal saline. Rationale. These signs suggest an acute transfusion reaction, possibly anaphylactic or hemolytic. The transfusion must be stopped immediately and IV access maintained for emergency meds or fluids. Question 25. An intubated patient on mechanical ventilation has sudden peak airway pressures and absent breath sounds on the left. SpO2 falls to 86%. What should the nurse do first? A. Suction the endotracheal tube. B. Disconnect the ventilator and manually ventilate with bag valve while assessing the chest. C. Call respiratory therapy and wait for assistance. D. Increase FiO2 to 100% on ventilator. Answer. B. Disconnect the ventilator and manually ventilate with bag valve while assessing the chest. Rationale. Sudden peak pressures plus unilateral absent breath sound suggests pneumothorax or tube obstruction. Immediate manual ventilation and assessment, and rapid decompression if tension pneumothorax, is life-saving. Question 26. A patient on heparin infusion has APTT 85 seconds, therapeutic 60 to 80, platelets 95,000 per cubic millimeter, and new purple discoloration at the injection site. What is the nurse's priority action? A. Decrease the heparin infusion rate. B. Stop heparin infusion and notify provider for possible hit. C. Apply pressure to the injection site and observe. D. Continue heparin and recheck labs in 4 hours. Answer. B. Stop heparin infusion and notify provider for possible hit. Rationale. Thrombocytopenia with new skin lesions suggests heparin-induced thrombocytopenia. Stop heparin immediately and notify provider. Continuing heparin risks thrombosis. Question 27. A patient with acute stroke arrives. Last known well 40 minutes ago. CT is pending. Which intervention should the nurse prioritize? A. Start IV alteplase if no contraindications and CT excludes hemorrhage. B. Obtain baseline fasting glucose and correct hypoglycemia. C. Begin aspirin 325 milligrams immediately. D. Prepare for emergent endovascular thrombectomy. Answer. B. Obtain baseline fasting glucose and correct hypoglycemia. Rationale. Before any thrombolytic decision, rule out hypoglycemia as stroke mimic. Checking glucose is immediate and essential to avoid inappropriate treatment. Thrombolysis, A, is time-sensitive, but glucose check is required first. Question 28. A postoperative patient with epidural analgesia becomes less responsive, RR 6 per minute, and pinpoint pupils. Which is the nurse's immediate action? A. Administer naloxone per protocol and call the provider. B. Increase oxygen via nasal cannula. C. Assess pain score and level of sedation. D. Stop the epidural infusion pump. Answer. A. Administer naloxone per protocol and call the provider. Rationale. Signs indicate opioid overdose from epidural opioids, respiratory depression, and meiosis. Per protocols, naloxone is emergent to reverse respiratory depression while notifying provider. Stopping infusion is secondary if safe to do. Question 29. A patient on continuous insulin infusion has blood glucose 58 milligrams per deciliter and is alert but shaky. What should the nurse do first? A. Bolus 50% dextrose IV. Give 4 ounces, 120 milliliters, fruit juice PO. C. Decrease insulin infusion rate and repeat glucose in 15 minutes. D. Push IV glucagon. Answer. B. Give 4 ounces, 120 milliliters, fruit juice PO. Rationale. The patient is alert and can swallow. Give fast-acting oral carbohydrate first. If unable to swallow or altered LOC, IV dextrose would be indicated. Also adjust infusion afterward. Question 30. A patient on urine output monitoring becomes oliguric, UO 15 milliliters over past hour, and K 6.2 milliequivalent per liter on lab report. ECG shows peak T waves. What is the nurse's priority immediate action? A. Administer IV insulin with glucose per hyperkalemia protocol. B. Increase IV fluids and recheck urine output. C. Give oral Kexalate. D. Notify the provider and prepare for hemodialysis. Answer. A. Administer IV insulin with glucose per hyperkalemia protocol. Rationale. Peak T waves with potassium 6.2 is life-threatening. Stabilize serum potassium quickly, shift potassium intracellularly with insulin plus glucose, while arranging definitive treatment. Waiting for dialysis is delayed. Question 31. An ED patient with suspected tension pneumothorax has hypotension, tracheal deviation, and absent breath sounds on the right. What's the nurse's first immediate action? A. Obtain a chest X-ray to confirm. B. Prepare for chest tube insertion in the OR. C. Perform immediate needle decompression at the second intercostal space. D. Administer IV fluids and observe. Answer. C. Perform immediate needle decompression at the second intercostal space. Rationale. Tension pneumothorax is an immediate life-threatening condition. Needle decompression relieves pressure and stabilizes before chest tube placement or imaging. Question 32. A patient with acute GI bleed is pale, HR 132 BPM, BP 86 over 50 millimeters of mercury, hemoglobin 6.8 gram per deciliter. Which action should the nurse carry out first? A. Prepare for immediate PRBC transfusion and type and cross. B. Give a bolus of IV crystalloid and notify provider. C. Place the patient in Trendelenburg position and observe. D. Insert an NG tube to assess bleeding. Answer. B. Give a bolus of IV crystalloid and notify provider. Rationale. Initial resuscitation with IV fluids to stabilize hemodynamics is immediate while preparing transfusion. Rapid volume support is first to maintain perfusion. Question 33. A ventilated patient develops sudden asymmetrical chest rise, hypotension, and rising airway pressures. What is the nurse's next immediate step? A. Order a stat chest X-ray. B. Perform immediate needle decompression for suspected tension pneumothorax. C. Suction the endotracheal tube. D. Increase positive end expiratory pressure PEEP. Answer. B. Perform immediate needle decompression for suspected tension pneumothorax. Rationale. Sudden deterioration with hypotension and increased airway pressures suggests tension pneumothorax. Immediate decompression is life-saving before imaging. Question 34. A patient on continuous heparin infusion for PE has sudden hematuria and hypotension. APTT returns greater than 120 seconds. What is the first nursing intervention? A. Stop the heparin infusion and prepare protamine sulfate. B. Call the provider and document the bleeding. C. Decrease the heparin infusion rate to half. D. Maintain current rate and monitor vitals. Answer. A. Stop the heparin infusion and prepare protamine sulfate. Rationale. Active bleeding with supratherapeutic APTT requires immediate cessation of heparin and reversal protamine, as per protocol, while supporting hemodynamics. Question 35. A postoperative patient is restless, pulling at lines, HR 138 BPM, BP 70 over 40 millimeters of mercury, urine output near 0. Which is the nurse's priority action? A. Provide reorientation and presence at bedside. B. Assess surgical site for hemorrhage and apply pressure, if found. C. Increase IV analgesia for pain. D. Place a Foley catheter to accurately measure urine output. Answer. B. Assess surgical site for hemorrhage and apply pressure, if found. Rationale. Restlessness, hypotension, tachycardia, and oliguria are shock signs. Postoperative hemorrhage must be ruled out and controlled immediately. Question 36. A patient receives TPA for ischemic stroke and now has sudden severe headache, vomiting, and BP 190 over 110 millimeters of mercury. What is the nurse's immediate action? A. Lower the head of the bed and obtain CT scan stat. B. Give antihypertensive per protocol and stop TPA infusion. C. Continue monitoring and recheck BP in 15 minutes. D. Give antiemetic for vomiting. Answer. B. Give antihypertensive per protocol and stop TPA infusion. Rationale. Sudden headache and vomiting post-thrombolysis suggest intracerebral hemorrhage. Stop TPA and manage BP emergently to reduce further bleeding and obtain CT. Question 37. A patient with DKA has potassium ion 3.2 milliequivalent per liter, is acidotic with pH 7.15. Insulin infusion is ordered. What should the nurse do first? A. Start insulin infusion immediately to correct acidosis. B. Give potassium supplementation before starting insulin. C. Obtain an ECG and then start insulin. D. Give a bicarbonate infusion first. Answer. B. Give potassium supplementation before starting insulin. Rationale. Insulin drives potassium ion intracellularly. With low potassium, less than 3.5, starting insulin will precipitate severe hypokalemia. Replace potassium first per protocol. Question 38. A patient in the ED has signs of anaphylaxis after IV dye. wheezing, hypotension, and angioedema. What is the nurse's first action? A. Administer intramuscular epinephrine immediately. B. Start IV fluids and call the provider. C. Give high-dose steroids for. D. Administer antihistamine PO. Answer. A. Administer intramuscular epinephrine immediately. Rationale. Epinephrine IM is the first-line, life-saving treatment for anaphylaxis. Fluids or steroids or antihistamines follow. Question 39. A patient with acute chest trauma is restless, tachycardic, and has neck vein distension with absent breath sounds on one side. What is the most urgent nursing action? A. Intubate immediately. B. Perform emergent needle thoracostomy on the affected side. C. Obtain a portable chest X-ray. D. Start IV antibiotics and fluids. Answer. B. Perform emergent needle thoracostomy on the affected side. Rationale. Neck vein distension plus absent breath sounds plus hypotension or tachycardia indicate tension pneumothorax after trauma. Needle decompression is immediate life-saving therapy. Question 40. A patient on continuous infusion of nitroprusside develops altered mental status and metabolic acidosis after 72 hours of therapy. What should the nurse suspect and do first? A. Cyanide toxicity. Stop nitroprusside and notify provider immediately. B. Lactic acidosis. Give IV sodium bicarbonate. C. Renal failure. Check creatinine and reduce dose. D. Increased intracranial pressure, head elevation, and hyperventilate. Answer. A. Cyanide toxicity. Stop nitroprusside and notify provider immediately. Rationale. Prolonged nitroprusside infusion can cause cyanide toxicity, presenting with altered mental status and metabolic acidosis. Stop infusion and escalate care immediately. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.